So 25 years ago, I had facial feminization surgery, and I've been wanting to do this for a while and talk to the next generation of people who've had facial procedures. And so I'm so glad that you joined us today. Can you tell everybody your name and a little bit about yourself?
My name is Ashley Dawson, and I'm 40 years old. I am Director of Business Intelligence for a large ready-mix concrete company.
Nice. And can you tell us when in your transition you had facial feminization and sort of what the arc of your transition was?
Yeah, I mean, I think like a lot of people, I mean, I had been thinking about it forever, but it was my early 30s before, I finally decided to, seek treatment. So I transitioned medically a few years before I did socially. Um, and having FFS that was the last step before I, transitioned socially. So that was really what gave me the confidence, I guess, to finally, get things started.
And why did you choose that sort of course of action? I did the same thing, and for me, it was because I could probably at the time have been fired without recourse, and so I knew I needed to blend in and make it easier for people to accept me. But what was your reasoning when you were making your decisions?
Exactly what you said. I mean, for better or worse, people tend to believe what they see, right? So if you seem like you fit in and you blend, it's, I hate to use, it's much more palatable for people, but they tend to be a lot more accepting.
Yeah.
Um,
Yeah.
and
In a perfect world, we could be ourselves, but we don't live in that world always.
it's exactly right. I mean, the reality is that uh, people are incredibly judgmental, and it was very important for me to have that ability to blend in.
So when you were going about making the decision to have facial surgery, can you talk us through what kind of research you did and how you came to your conclusion?
Yeah, I think like everyone else, we start just, it's on the internet, right? And um, where I wound up was very different from where I started. I when I started looking, there were two, fairly prominent, FFS surgeons who, one on the East Coast, the other, more in the Midwest. That seemed to be, everyone's very starting points, or they seem to be the big names in the game. And the more research I did, um, more led me to Dr. Osterhaus, and then obviously to Dr. Deschamps-Braly, and started talking to people that had gone to him, saw their results, and was totally blown away. And once I, figured that he was, if he was the handpicked successor of, the guy that invented the surgery, it kind of made it an easy decision. And then, even though I was fairly sold when I finally went out and did my consult, that just cemented things for me.
And
He
did
has
you do any other consults, or was it just the one?
just the one.
And
So
can you
um,
walk us through what the consult is like?
yeah, it's a pretty amazing experience. They start off by doing an imaging of your cranium, your facial cranio features, so that he can really make an accurate judgment for what he can and can't do for you. And then you go in, and the office staff is amazing. Everyone's so warm and accepting. And then you meet, Dr. Deschamps-Braly, and he's the same way, right? It's it's really rare, to find a surgeon who's that, talented from an aesthetic perspective, but who still, just has a really nice, caring, he seems like he genuinely, cares about his patients, which I don't think is something you get from a lot of doctors.
Yeah, yeah.
So
It's an interesting thing, and it was the same thing with Osterhout. I think um, it's having had several surgeries. They sort of have been trained about having a bedside manner or whatever, but there's something different about, especially with plastic surgeons I've met, where it seems like they're connected more to who you are as a person.
I definitely agree with that. Yeah.
So you have the consultation, and when did you make the decision? Like, did you decide that day that you were going to go with?
Immediately. Yeah, definitely. As soon as, like I said, I was fairly, certain going into it, but I signed up that day.
And can you sort of let people know how it works once you make that decision, like in terms of deposit and how that all works?
Yeah, I don't really remember what it was, what the percentage was, but the point is, to secure a date, you need to put down a deposit. So obviously I did that. And maybe it was 8 weeks prior to surgery, 10 weeks prior to surgery, you had to have, the rest of the funds down. Um, that wasn't an issue for me. Uh, I mean, I think now he's accepting some forms of insurance. At the time, it was entirely out of pocket, which wasn't, like I said, which wasn't that big of a deal. But um, so yeah, that's all the process I remember.
So you had saved up and you had the funds available when you booked at the time, correct?
I did. Yeah, I've been very fortunate. I have unlike or like many of us, I had a really good job and my family was incredibly supportive. So the money wasn't an issue.
Well, I consider myself very lucky as well, because so many of us are not in such a privileged position. So it is great that we were able to get the money together and do this out of pocket.
Was the when the bell rings, and when your bell goes off and you figure out your trance, like there were so many accounts of it just being this like horrific, awful experience. And I I think it's kind of one of those things where it's unfortunate, but is it a big deal? Yeah, it's a big deal. But if you have money to treat it, it's not that big a deal.
Yeah, money equals options.
Yeah.
And one of the things that I always tell people is that the biggest part of planning is really thinking about the financing and how you can do that. And there's ways to do all of this if you really prioritize. And I've got some information on my website if people are interested on how to finance things and pay for things. But it's definitely something that weighs heavily on most people's minds. So I'm glad that you were not in that situation where it was a huge struggle for you. So once you put down the deposit, and how long was it until the actual surgery? Like, what was your wait time? Do you recall?
Yeah. So I had my consult the day after Labor Day,
Mhm.
and I had surgery the following April.
Okay, so roughly what, 7, 8 months, something like that.
Yep. And that was as soon as I could get in.
Yeah. Yeah. Wait times are something that are highly variable. So everybody who's watching this, be sure to check in and just see, because that can change. And if you have a flexible schedule, sometimes you can get in sooner. I did that with my bottom surgery. It was like 2 years out, and all of a sudden, like 2 months after I made my consultation and booking, a slot opened up. So you never know. You just have to be ready for whatever.
Yeah, bottom surgery was a little different. I want to say I went, so it had been a full year since facial surgery. And so I went for my consult in April, and I had surgery the day before the 4th of July. So that was pretty quick.
So let's sort of back up to right when you arrive for the surgery itself. So you did it all in one series of procedures, right?
Yeah, it was really easy. You show up and everything's ready, and you're greeted by. I had a wonderful nurse. I think I think they had just switched hospitals a few months earlier, and the whole nursing, the whole staff had gone through training on you know trans-specific you know um, things, and the nurse was incredibly, like I said, welcoming and caring, and they get you all set up, and then Dr. D comes in and talks to you about what he's going to do, and really, just lays your mind at rest. And then before you know it, you're waking up with the world's worst headache.
And can you describe the recovery? So some people have what they would consider discomfort. Other people say it's painful. How was it for you?
So, like I said, I woke up and had just a horrible headache, but I was under for 11 hours, I want to say 10 and a half to 11 hours. And so he gave me something for the pain. And I don't really remember much of that night. So I woke up the next morning and remember this beautiful view of the bay. And it was like 6:30 in the morning, and he had surgery that day, but he still came in to, see how I was doing. And then they removed the drain tubes, and they sent me home. And honestly, that was about as much discomfort as I felt. The liquid diet wasn't great, but I really didn't feel in pain. The recovery was really easy. The toughest part, I think, was just mentally, like, knowing you need to give it a lot of time, right? Because you're bruised, you're swollen, and that going in, but it's different once you're actually seeing it, right? So that was tough, just knowing that it'll be fine, but just let it be.
And what all did you have done?
So I had, obviously, I had forehead reconstruction type 3, orbital shaving, nose job, fat transfer, um, jaw shave, and sliding geniostoplasty. There
Genioplasty. Yeah, yeah.
we
Yeah, I
go.
had that too.
And tray shave.
Mhm. And did you do anything with your hairline?
No, he left. I had already had. I actually had a fairly receded hairline prior to, like, starting transition. So I'd already had a scalp advance and hair transplants a few years prior.
Mhm. And did
So
that affect your other work done, or was there any issues there that you recall?
it didn't seem to.
Because I
Um,
had some hair transplants before I did it, and they had to cut them all out, is why I'm asking.
yeah, he actually, my this part of my hairline, he actually used to be a little more V-shaped, and he actually cut that out. So I have a much more round hairline now.
Mhm. And when did you start seeing the results, and how long did it take till you really felt like it was complete, the healing?
It's funny. We we see ourselves so differently than the rest of the world does, right? I came back. You're out there for 2 weeks, right? So I remember I hadn't, because again, I hadn't transitioned socially at all. So I still had, my normal license. So I remember being at the TSA in San Francisco and having to argue with them that, I was who I was. And I'm like, you guys are literally the TSA in San Francisco. You should probably be a little more up on this than, anyways. So I remember flying back, and I went back to work within a couple of days, and again, very bruised, but I was still very much like, you know what, I'm going to wait for the swelling to go down. Maybe I'll transition, sometime this summer. And a few weeks later, mind you, all my friends are telling me, they're like, no, you don't get it. You look completely female. Like you're the only one who's, who thinks you still look, like a guy. And I was flying home a few weeks later for my dad's birthday. And I remember I was using the restroom and I was washing my hands. And I'm wearing a polo shirt and a pair of khakis, right? Like just normal work outfit. And I'm flying home and I wash my hands in the bathroom, and this guy comes walking in and he looks at me and immediately runs out of the bathroom. And then a few minutes later, he comes walking back in, and you're just joking like, no, you got the right place. And then when I was flying back, I asked somebody where the restroom was, and they immediately directed me, towards the women's restroom. And after that, it pretty much, we had a board meeting the next day, and I talked to the board and I was like, so the plan initially, I know we said it was going to be July. This is pretty stupid. So I switched over. We had a meeting. They had told everyone that I hadn't personally talked to. They had a meeting while I was out for surgery, so everybody was expecting it. But quite frankly, by the time I really talked to people, nobody was really surprised. So that was it. It was pretty painless.
Well, and it sounds like you had some very good feedback to give you that confidence. I think that's one of the big things for a lot of people that doesn't get talked about that much. Can you talk about how it changed how you felt about yourself?
Yeah, it was kind of mind blowing, honestly. The only way I can really describe it is I I could pass prior to facial surgery when I wanted to, but I had to work at it, right? Now I have to convince people, now you tell people you're trans and they're like, no, that can't be right, because you look. And it's like I said, it's quite a mind blowing situation. So, in obviously in a fantastic way, but it takes a lot of getting used to, because so much of your identity is in your face, right? So you're used to looking a certain way, and you hope. I remember, obviously, like, so much of it is like your profile, right? So I remember when they took the nose cast off and showed me my profile for the first time, kind of getting teared up, because that's, you dream about it, but until you hope it's going to happen, but until it really does, it's a very emotional experience. And it really does amazing things for, like you said, for your confidence. Like I said, people treat you like they see you. So that's, I think that, I'm in an incredibly male dominated, what many would, consider a very closed minded field. And I didn't have any issues at all. So that was a big deal for me.
And I'm sure a lot of that is that you were very good at your job and a number of other things. So how much of that would you attribute to the fact that you had facial feminization surgery, like as an investment in yourself?
Oh, it's a huge thing. I mean, yes, I'm very good at what I do. I'm a fairly high profile, at a national level. And I am not in any way naive enough to believe that, had I not taken all of the requisite steps, culminating in FFS, that I would have had the same kind of acceptance that I did. People now, well, they were incredibly supportive. And like I said, I think people tend to be a lot more supportive when you fit into a particular aesthetic.
Yeah, we think about this stuff so much, and I don't think most people do. So um, most people are just responding in a very basic, unconscious way about gender and sex and those kinds of things. And so it's to our advantage that we think about it a lot, but it also can get in the way sometimes if it's keeping you from being confident in just being who you are. And I think for me, at least, facial feminization made a huge difference in my moving through the world and feeling safe and confident. And I don't know, how would you describe, for instance, the way people respond to you socially? Like what differences did you see after you had facial feminization?
The crazy thing for me was it wasn't, like I said, I didn't really socialize, prior to FFS, as a female. The crazy thing socially was once I did switch over, um, everyone, like, friendships became so much deeper, and I felt like I had genuine relationships with people for the first time in my life. Because prior to that, you always have this like mask that, you're trying to, this fake person you're trying to portray. And people really responded incredibly positively once I dropped that. And, they could really get to know me. And that was a huge thing. Like, people just treated me like I had been, like I was female, and that it wasn't that big a deal. And it was just like I said, they were so genuine about it. Um, I it's crazy, honestly. The whole just like being accepted into a group of women or excluded from a group of guys, which took some getting used to, right? The whole like social aspect of you you have an opinion on economics or sports or whatever, something that is guy talk, and you're like automatically dismissed, right? And yet, you can have these amazing, deep, substantive conversations with, other women that I never believed I'd get to have. And I don't, like I said, I don't think there's any chance prior to FFS that would have happened.
Yeah, I feel the same way. It changed the way I move through the world. And it's really hard for people to understand what a difference it can make in how people respond to you. It's like, just there's something nice about just being nice to someone if they think that you're a attractive woman. When I was younger, especially, like, it was just so lovely to have that interaction with someone and be able to kind of make their day just by being nice to them. And I just,
That's insane. Yeah, you just nailed it. Like, because we weren't brought up like, knowing that, right? So you're just thinking you're being a reasonably decent person, and next thing you know, guys tend to just get the total wrong, idea. But I kind of jokingly say this all the time, not on like the guy front, but it is amazing just to, and I don't want to say be normal, because I don't want to have like that stigmatization that it's not normal to be trans, but it's pretty awesome to have like a boring normal like life, right? That you can go about your day. Like, I can go into work and go to the supermarket and go out with a few friends, to grab a drink like I did last night after work, and just have a normal time, right? And with with FFS now, with the exception of dating, I don't really think about being trans. It's who I was, and it's a part of me, but it's not a part of my everyday life, right?
yeah.
And I can't think of anything that was more impactful to that than having facial feminization surgery.
Yeah, that's very well put. It's really, it's funny how quickly you almost forget about transition itself. You know, I think for people who are doing the research and probably watching this, it feels like it's your entire life for a minute, but we don't do this for the during, we do it for the after. And the after
Right.
is hard to imagine when you're in the middle of it, but the after can work out really well if you plan carefully, have realistic expectations, and go into it with the right attitude. And
I think you just touched on something really important too. Like, it's facial feminization surgery, not I want to be a supermodel like surgery, right? So you have to have realistic expectations. That's totally um that's and I don't know that that's focused on enough. Um, you know, that
yeah,
it's a huge deal, right?
yeah. And, you know, I think what you're trying to get at is something that I tell people a lot, is that there's a big difference between quote unquote passing and attractiveness. And
That's
that
right.
in a lot of ways, it's harder if you're attractive, because people, especially men, are looking at you much more closely because they're sort of eyeing you up because they're attracted to you. And so you look at someone different when you're attracted to them, and that can make it a little harder to blend in. So, you know, I'm glad that I just, you know, kind of look like a regular I'm very tall, but I just kind of look like, you know, somebody walking down the street. I don't really stand out beyond being tall.
Yeah, I kind of like coming across as, you know, like your fairly typical like 40 something soccer mom. Like, nothing, you know, spectacular, but you know, like you said, just being able to go about your day-to-day normal life. Um yeah, guys are, although I mean, I dating, well, that's a whole different deal. But yeah, it's a huge deal just to blend in. That's right.
Yeah. And, you know, dating is an interesting adventure in and of itself that maybe we'll have to do in another video or
Whole
something.
entirely different deal. That's right.
But yeah, so one last question for people who are trying to make the decision as to who to go to. How would you describe Dr. D?
Like I said, he is incredibly genuine and caring and um, thoughtful, uh, but also incredibly, he's an artist, right? So when you're having a conversation with him, you can tell like he's evaluating everything, right? And he's, you know, prior to, he's thinking about what he's going to do, you know, in post, he's evaluating, you know, how, you know, the outcome. And just that connection, you know, through your face, right? I mean, it's your most important feature. And this is whose hands, you know, you're putting it in. And I think he really grasps, you know, the gravity of, you know, he's literally holding, you know, not your, well, I mean, I guess I'd say your life, but certainly the quality of your life, you know, in his hands. And also he recognizes what a huge deal it is, you know, for the patient. So I can't say enough positive things about, you know, him and his whole staff.
Yeah, yeah, it's really amazing when you find the right person, and it all comes together. And I'm so glad that you had such a great result, and that you're so willing to talk to others and help them make more informed decisions about their own care and their own plans, because I know how important that was for me. So it's really wonderful that you're paying it forward.
No, that's definitely, you know, I was really excited, you know, when you guys reached out for this, because honestly, I don't do much in my, you know, like we talked about, like my day-to-day life is just, you know, a normal 40-year-old woman, right? I don't hide the fact I'm trans, but I also certainly don't fall into the category of, you know, being an activist. And this has been really great for me, that to hopefully be able to help, you know, other people.